taking care of your heart, you start off young with a heart, born with it, you grow up, and it's amazing the wear and tear and stress you put on it.
The heart is the one single muscle that basically controls our living being. We have to take care of it, and I don't think on a regular basis we think about the foods we eat and how it affects it. Emotions, stress, exercising, sedentary lifestyles, all of these things fuel the heart. So I believe that, going out and really taking care of yourself is going to increase the longevity of it. So we have to be conscious of what we're doing.
I used to climb 49 steps into 160, and at each landing I would have to stop, take a breath, rest for 2 minutes before I get to the next landing. So I went to a doctor, got myself checked out.
I wasn't scared until I was scared. That sounds a little strange. I wasn't scared until the doctor walked into the room with me and looked me in the eye and said, "You're having a heart attack."
I think it's really important to know the warning signs, especially because my family has a history of heart disease. So it's important to me to know and understand what could happen and what I can do to prevent it.
Well, it's important to me because in 2010 I went into cardiac arrest. I ignored every sign that morning and I went, I'm 52. I can't be having a heart attack. I went to the gym that morning and got on the elliptical with my girlfriend and actually got off the elliptical 3 times and stretched my arm. That's how much I ignored it until I collapsed in the elliptical machine.
And then they found I had 3 blockages and I needed surgery pretty quick. So they shipped me to Norfolk General by ambulance.
The day that I got the call, I was here at work. It was a normal day. And it just took me completely by surprise. I was a brand new mother. The last thing that I thought we would have to worry about was losing my mom. I immediately took off work to go be with her, and it was traumatic for the entire family.
It's incredibly important to recognize the warning signs. It's, I think, more important to not deny the warning signs of a heart attack. So, I can remember sitting at home undergoing the symptoms of a heart attack, actually, I guess, in the early stages of a heart attack, and telling myself, this can't be a heart attack.
It's important to me because having kids and having a family, you want to make sure that you're around for them. So since it doesn't strike me personally or my kids directly, I want to make sure they're aware of stuff that goes on. It happens at any age, having a heart disease or stroke. So make sure they're aware, making sure they stay active, and just participating in these events to me is very important because you just never know. It could be me, it could be them at any given day.
Recently, back in October, a few months ago, I noticed some changes as I was exercising and something wasn't quite right. So I sought out a doctor for a physical and noticed that an increased heart rate was actually the sign of an actual heart issue that I have. And so now I take medication for an irregularity, and I am under control with daily medication, and I exercise regularly. So you don't have to be in poor health condition to be affected by heart disease. So you need to ensure that you're monitoring yourself at all times, and so that you can look out for any signs or symptoms that may just be irregular. Exercising on a daily basis didn't prevent me from being affected as well. So I think that working safe and making sure that we take care of ourselves here at work will also ensure that we can go home and take care of ourselves as well.
A lot of people feel like if they work out, it's too expensive. But like I said, you can walk around your neighborhood, you can park out further at the mall. Little simple things that you can do at home really help out.
So focusing on the heart walk, spending time with fitness and nutrition, and using opportunities like the heart walk to raise awareness of heart disease so that in some small way I can give back to others a little bit of a learning experience to not do what I did and to recognize the symptoms of a heart attack early. If I can help just one person, then all of the effort is absolutely worth it.
Well, the American Heart Association, they conduct research and they take care of patients, just like my mom at the Norfolk Heart Hospital. So it's important, it's a chance for me to give back and support the hospital that saved my mom's life.
I feel better. First day I came back, I walked straight up the steps without stopping. I didn't use the freight elevator.
Your health and safety is the number one. And they're showing you that by implementing programs like stretching program, being able to get checkups, like if you're not comfortable with going to the doctor and do your checks. That's actually how I found out that I had high cholesterol.
She's doing very well. She's also conscious of her heart, and she's going to her regular checkups, and we hope that she stays with us many more years. At the Heart Walk, she's usually one of the proudest ones walking around, being a survivor.
It's okay to go get checked out when you don't feel right, and you know when you don't feel right. And it's okay to go get checked out and be told, hey, you're okay. That's all right. And it's much better than to arrive at the hospital and be told, hey, you're not all right.
You have to remember that it could hit anybody, and we should all be conscious and make sure that we're doing everything we can to prevent heart disease.